it's something to burn into your memory.
Okay, so we have
Have any ideas?
Ummer is asking hamartomas and Cowden's disease.
Yes. So these are multiple testicular hamartomas, usually symmetric bilateral. I actually did a literature search on this. I couldn't find anything specific does a pathologic correlate. Some people say that they're small lipomas. Some people say they're Leydig cell hyperplasia, but it is associated with multiple hamartoma syndrome or Cowden's disease. So these patients, we have several of these patients, and they come back pretty regularly for various screening. So one of the associations is thyroid pathology. So we did a thyroid ultrasound, and of course we have a nodule on the right, solid with calcifications, and then a small one on the left, upper pole, very hypoechoic, ill-defined margins, no calcs. This happened to be papillary thyroid cancer. The other one turned out to be a follicular adenoma, but then went to thyroidectomy. A lot of us see these quite often. So again, if you haven't seen, especially any trainees on, if you haven't seen the multiple, somewhat geographic, homogeneously hyperechoic nodules throughout both testes, that's multiple hamartomas in the setting of Cowden's syndrome. The reason I wanted to bring up this case is I had a case relatively recently.
Wait, is there anything else in the differential there, or that just so pathognomonic? Like if it's hyperechoic, you would just go like... Again,
I did a literature search, and mostly when you look up the differential for multiple echogenic nodules, nothing really comes up. A lot of papers say that Leydig cell tumors or Sertoli tumors are more often echogenic relative to seminomatous and mixed germ cell tumors of the testes. But when you have them, innumerable echogenic like that, that was really the only thing that came up in my differential. I don't know if anyone else has anything in their back pocket.
Very cool. Anu is asking if they're vascular. And Umar said-
They were hypovascular.
They're what?
They were all hypovascular.
Hypovascular, okay. And Umar,
we didn't do contrast or kind of microvascular imaging or anything, but on standard color Doppler, they were hypovascular relative to the testis.
Cool.
So this is a similar patient, actually an older patient, 62-year-old male, diagnosed by Cowden's syndrome by identifying the characteristic P10 tumor suppressor gene mutation, and had a palpable goiter. And this is what their thyroid looked like. And oftentimes when we see thyroids like this, they're going to be associated with Hashimoto's. But this was huge, and multiple similar appearing isoechoic homogeneous nodules, and the thyroid is almost carved up into these nodules by these fibrous bands, as you can see, almost like a cirrhotic looking liver, lots of calcifications. And this is actually a morphologic appearance of the thyroid that I had also found in literature research as also associated with Cowden syndrome. This is basically innumerable adenomatous nodules replacing the normal thyroid gland. So the normal thyroid gland kind of gets compressed and fibrotic, and then the normal thyroid bed gets replaced by innumerable adenomatous nodules. So,
wow. This reminds me of that case you showed last week of the thyroid lymphoma. Although
right.
There weren't as many bands in that other one.
Right. I mean, you can see how big this thyroid is, but this was a chronic for this patient. And again, it was more thyroid enlarged and carved up into innumerable nodules, as opposed to the one I showed last week, where there was no defined nodule. It was just markedly enlarged, homogeneously heterogeneous, or diffusely heterogeneous and hypervascular. So I had never seen a thyroid like this, but apparently there is an association with Cowden syndrome and innumerable adenomatous, basically adenomous replacement of the thyroid.
Cool.
That was it.